Think about it. Right now, you may be in danger, lurking in the most unexpected places. Did you know that often when people notice alarming signs in their legs, their lives may be at risk, and the loss of time is measured not in decades, but in years? Medical experts do not always pay attention to the fact that serious diseases that can lead to death often begin to develop in the legs, especially after 65 years, and often proceed almost unnoticed, not showing themselves until it is too late. Today, we will tell you about 3 little-known but extremely important symptoms that appear in the legs and can serve as a warning of impending danger. Moreover, we will discuss methods that will help stop this process and prevent the disease from taking away precious years of your life. Thanks to many years of research, specialists in the field of vascular surgery and human life extension have acquired unique knowledge. Unfortunately, this information is rarely available to the general public. What you are about to learn could be the difference between life and death, or the lives of your loved ones. So, are you ready to learn about the critical signs your body is giving you and the simple but effective ways you can extend your active and healthy life by 10, 15, or even 20 years? Stay tuned to get important information and not miss the opportunity to change your life for the better. To highlight the importance of awareness, consider the life of Gennady, a 60-year-old retired engineer who had always preferred an active lifestyle. His days were filled with morning walks and gardening until he began to notice swelling in his ankles in the evening. Considering this a natural consequence of aging, Gennady did not pay much attention to it. The occasional cramps in his legs when climbing stairs also went unnoticed. During annual medical checkups, doctors paid little attention to these symptoms, and no one warned Gennady that these seemingly insignificant changes could portend a serious health threat. The turn to tragedy occurred 6 months later when Gennady collapsed in the driveway of his grandchildren's house. The diagnosis was harsh. A massive blood clot had broken off from his leg and traveled to his lungs, causing a pulmonary embolism that nearly cost him his life. The ambulance doctor told Gennady the shocking truth. The warning signs had been visible for months, but no one had been able to recognize them in time. If these signals had been noticed earlier, the tragedy could have been avoided. Gennady spent 3 weeks in the hospital, incurring significant financial expenses, all due to a lack of information about 3 critical signs, which we will discuss below. Now it is important to understand these dangerous symptoms that appear in the legs and learn to recognize them in order to prevent dire consequences. Permanent swelling is not. Swelling of the legs that does not go away over time should be a cause for concern. If swelling in the ankles or calves persists in the evening after standing for a long time, or if shoes feel too tight and the swelling does not go away even after a night's sleep, this may indicate serious health problems. Vascular surgery specialists note that constant swelling in the legs often indicates a malfunction of the heart, which has difficulty draining blood from the lower extremities. This condition is called venous insufficiency, which significantly increases the risk of life-threatening cardiovascular complications, increasing it by about 84% within 5 years. The findings are even more alarming. A 10-year study published in the respected American Heart Journal found that older adults with chronic leg swelling were 57% more likely to die from any cause than those without the condition. The obvious question is, why do doctors often fail to properly inform patients about such a dangerous symptom? The answer is that the problem often becomes noticeable only in the later critical stages of the disease. Take Natalia, 73, for example. She first noticed swelling in her ankles after playing bridge with friends every week. She thought it was just the result of sitting for long periods of time, she recalled. Many older people don't pay much attention to this, considering it just a minor phenomenon. Natalia decided to start wearing more comfortable and loose shoes along with socks to alleviate the swelling. She didn't realize that her body was desperately trying to send a signal about a serious danger to her life. 3 months later, Natalia was rushed to the hospital with severe shortness of breath. A medical examination revealed that her heart was working at only 35% of its normal capacity. The cardiologist explained that the swelling in her legs was the first sign of congestive heart failure, a disease that, without proper treatment, reduces the average life expectancy of patients to just 5 years. Natalia said bitterly, "If only someone had told me then what these swellings really meant." However, there is good news. Every person is able to take measures in time and stop the dangerous process, possibly prolonging their life for many years. It's a special method known as the 333 protocol, which has been shown to save many lives. The first and most important thing is to elevate your legs for half an hour every day, keeping them above your heart. The best time to do this is right after lunch, when the body tends to retain fluid the most. It should be understood that simply placing your feet on a special support is not enough, because this does not create the necessary pressure difference for the veins to function properly. Instead, it is recommended to lie down and place your legs so as to ensure optimal blood flow. 3 rolls under the calves and feet. This simple technique, according to experts, can significantly improve the function of the veins in just 1 week. The second important rule is to completely eliminate 3 hidden sources of sodium in the diet: canned soups, processed meats, and some antacids. Many older people do not even realize that these familiar products can contain more sodium than 8 bags of potato chips. Vascular surgeons claim that eliminating only these items can reduce the risk of dangerous leg swelling by almost 40% within 3 days. The third necessary step is to conduct a simple test every morning for 30 seconds with socks. You need to press your big toe hard against the front of the ankle for 3 seconds and release. If the indentation does not disappear for more than 5 seconds, it is better to consult a doctor without delay. You should ask for a blood test for BNP. This measures levels of a hormone that can help detect heart failure long before standard test examinations will show that there are problems. You should think about whether a person is following these 3 basic steps or putting his health at risk. You should not wait until suffocation occurs in the emergency room to seriously address this issue. The second alarming sign that requires close attention is changes in skin tone and temperature fluctuations in the legs. You notice how certain areas, the feet, become unusually pale, acquire a dark bluish tint, or on the contrary, turn alarmingly red in certain areas. It feels like the feet are significantly colder than the rest of the skin on the body. At first glance, such changes may seem insignificant, but in fact, they serve as a serious warning of possible disorders in the body. Numerous scientific data confirm that such changes in skin color and temperature often indicate the development of peripheral arterial disease, known as PAD. This is a dangerous condition that statistically increases the risk of stroke and myocardial infarction by 4 times within 5 years. Of particular significance is a landmark study published in the prestigious Journal of Vascular Surgery, which found that 76% of elderly patients with such symptoms who did not receive timely and proper treatment died within 8 years. Janet Vanoy, a member of the vascular medicine department at the University Medical Center, explains that changes in the color of the skin of the feet are associated with impaired blood circulation in certain areas, similar to a plant wilting due to a lack of vital moisture. Unfortunately, most patients do not even realize that this is the initial stage of tissue damage, when cells begin to die due to a lack of oxygen and nutrients. Gennadi's story serves as a stern warning for older people. He is 69 years old, retired as an accountant, when he noticed a small pale spot on his right calf. It felt cold to the touch. His doctor didn't pay much attention to it, assuring him that it was simply the result of poor circulation due to a sedentary lifestyle. Gennady believed the doctor's words and did not change his usual rhythm of life. But over 4 months, the stain gradually grew larger, and any short walk became extremely painful. It was only when Gennady sought a second opinion that vascular specialists discovered 3 huge blockages in the arteries of his legs. These clots were on the verge of causing irreversible tissue death, which would have led to amputation. The doctor who treated him later explained that these blockages did not appear suddenly. Their signs had been visible on Gennady's skin for months. But not everyone has to suffer the same fate. There is a chance to detect these threats at home before they become deadly. Today, I present to you a simple 3-step protocol recommended by leading vascular surgeons, although it is rarely used. This method will help to detect blockages in time and protect your health. Message for patients. First, check your pulse yourself without delay. To do this, gently place your index and middle fingers on the back of your foot where it connects to your ankle. If your fingers are positioned correctly, you will feel a clear and rhythmic beat. Next, repeat the pulse measurement behind the inside of your ankle. It is very important to make sure that both pulses are clearly audible and have approximately the same strength. If one of the pulses is weak or absent, this is a reason to urgently consult a doctor. Delay in this case can lead to serious health problems. To improve blood circulation and naturally remove dangerous vascular blockages, cardiologists recommend regularly doing 3 simple exercises. These include rotating the ankle 30 times in each direction, bending the toes 50 times, and extending the legs while sitting, 20 repetitions on each leg. It is recommended to do this complex 3 times daily. Research shows that systematically performing these movements increases blood circulation in the legs by 35% in just 2 weeks. At the same time, it's worth enriching your diet with healthy foods such as fresh berries, especially blueberries, fatty fish such as salmon, and dark green leafy vegetables. A study published in the journal Circulation found that in older people, following such a diet significantly improves the condition of blood vessels and maintains heart health. People who eat these products at least 4 times a week reduce the risk of developing clogged arteries by 67%, compared to those who do not include them in their diet. The substances contained in these products have vascular protective properties and help dissolve existing plaques. However, the positive effect is achieved only with systematic and regular consumption of these products. It is worth considering whether you are ready to spend just 10 minutes a day on simple but effective methods of maintaining healthy arteries. The alternative is the sad prospect of becoming one of the many elderly people who each year face limb amputation or even death due to hidden vascular diseases. The decision is yours, but it must be made urgently. While there is still a chance to slow down the destructive processes and reverse the effects of unnoticed symptoms. One such warning sign is the occurrence of unexplained cramps or discomfort in the legs while walking. Do you notice that you have to stop to give your legs a rest from the sudden pain? Does it subside at rest, but resume again when moving? If so, then your body is persistently warning you of a serious threat. Scientific research clearly shows that this type of pain, known as intermittent claudication, is a characteristic symptom of peripheral arterial disease. This pathology takes the lives of many elderly people every year, so such signals cannot be ignored. The condition significantly increases the risk of fatal strokes by almost 4 times. In just 4 years, studies have revealed even more alarming data, showing a link between certain pain when walking and a significant reduction in life expectancy by an average of 10 years compared to those who do not experience such symptoms. Dr. Michael Reynolds, Director of Preventive Cardiology at the prestigious Northwestern Medical Center, noted that pain in the legs when walking is a direct signal from the body indicating a lack of oxygen in the muscles. In intermittent claudication, the painful attacks are a grim precursor to the suffering that people experience during a heart attack or stroke. They are a kind of warning from the body that dangerous blockages are developing in the blood vessels. For example, consider the case of Evelyn, a 70-year-old former teacher who loved to walk her small dog. Over time, she began to feel a burning sensation and cramps in her calf muscles, which forced her to stop walking almost at the very beginning of the journey. Initially, Evelyn attributed this to poor physical fitness and tried to ignore the pain. She admitted that she was embarrassed to tell the doctor about it, since it seemed a minor problem compared to the difficulties of other elderly people. However, 6 months later, during the celebration of her granddaughter's birthday, she suffered a severe stroke. The neurologist explained that the partial paralysis of the right side of the body was associated with leg pain, which became a serious warning about the formation of similar blockages in the arteries supplying the brain. If we had immediately paid attention to these symptoms in the legs, the doctor noted, it would have been possible to completely avoid the stroke. However, do not despair, because there is a ray of hope. There is a chance to stop the development of this dangerous disease before it is too late. Clinical studies have shown that the created method is capable of reducing blockages in the arteries by 30%, and all this without the use of dangerous drugs or surgical interventions. First of all, it is recommended to introduce into your daily life a simple 7-minute walking complex developed by experienced vascular surgeons. You need to walk until pain appears, even if it only takes 30 seconds. Then stop and wait until the discomfort completely disappears, and then start moving again. It is important to repeat this cycle, walking, stopping, starting, for exactly 7 minutes. Continuous movement will not give the desired effect. It is this change in activity that stimulates the body to develop collateral circulation, creating natural bypasses around clogged vessels. Research confirms that performing this complex increases blood flow to the lower extremities by 45% in just 1.5 months. Secondly, it is recommended to supplement your daily diet with 3 specific foods that have the ability to naturally dissolve atherosclerotic plaques. Among them are fresh garlic, at least 1 clove per day, pomegranate juice in the amount of 120 milliliters per day, and a handful of walnuts every morning. Scientific studies confirm that this combination helps to reduce arterial blockages by about 26% in just 90 days. And all this happens without the need for medication or surgery. It should be noted that experts strongly advise to immediately exclude one common product from the diet: corn oil. Scientific data have shown that it contains substances that accelerate the formation of atherosclerotic plaques in people over 65 years old. Instead, it is recommended to use extra virgin olive oil, and this replacement should be made without delay. Clinical trials have shown that such a simple step can increase the elasticity of arteries by about 31% in just 1 month. It is worth seriously considering whether the risk of ignoring these simple changes is justified when it comes to health and longevity. Natalia's story serves as a clear warning. Paradoxically, many older people miss such signals until it is too late. It is very important to closely monitor the condition of your feet, since even minor symptoms can be a sign of a developing serious problem. There is no need to increase the sad statistics of those who do not pay attention to the alarm signals of their body until they end up in the hospital. The advice presented can save lives, but only if they are followed quickly. Today, it is known that how to recognize and stop 3 extremely dangerous symptoms in the legs that can foretell an early death. After 65 years, these simple methods have already helped many people avoid strokes, heart attacks, and thromboembolism. It is never too late to start taking care of your blood circulation and increase the duration of your active life. Every person deserves to live to their 90th birthday without fear of hidden dangers. That's why it's important to take the necessary steps today to thank yourself for the valuable gift of extra years spent among your loved ones.